content provided by our bloggers or authors are of their opinion and are not intended to malign any religion, ethnic group, club, organization, company, municipality, individual, or anyone or anything.
He's a surgeon. He's a 100-ton boat captain. He's a lieutenant on Seaside Heights Beach Patrol in New Jersey. He's a member of the Coast Guard Auxiliary. He's Dr. Michael Kachmar. Need answers to your medical questions? We have them. Listen in to hear latest on medical topics related to all that and more.
Hello, everyone. This is Dr. Michael Kachmar. Thank you for tuning in to Scrubbing Up with Dr. Michael Kachmar. We are a medical, political show. We've been doing this for about 4 years now. We're on all the platforms: YouTube, Rumble, Facebook. If you go to YouTube, I appreciate that you subscribe and like us. You'll get notifications as well as Instagram.
Yeah, Facebook if you like us.
We do it. We do an Instagram. We're all over the place.
You'll get notifications that we're live.
Yeah. So my name is Dr. Michael Kachmar. I'm a board-certified reconstructive foot and ankle surgeon. Over 40 years of practice on staff at 4 hospitals, and again, I'm board-certified in foot and rear foot and ankle surgery, and I've been doing it for many, many years. We have my sidekick here is Jeremy. You want to say hello, Jeremy?
How you doing, guys? I'm your old pal, Jeremy. You know me. Yeah.
And if you want to call the office, the number is 732-269-1133. That's 732-269-1133. We also get them, Jerry. Get it.
Yeah, and Dr. Michael Kachmar's website is JerseyShoreFootAndLegCenter.com if you want more information about him, some of the supplementals we talk about, and of course, Heel Pain, which is the brand new heel pain center he's opened up at his place. It's nothing to be missed, man.
Good. So today's date, again, is this is February 22nd, the year of our Lord, 2025 A.D.
We made it.
Welcome. And we're broadcasting from Toms River, New Jersey. I have 2 practices, 2 offices, and we just we've been treating heel pain for years and years, but we're getting more and more, and we decided to dedicate part of our practice to a heel clinic, and that's pain of the anywhere of the foot and ankle and heel. We have new equipment now. Also, we've just upgraded our physical therapy department. We're going to talk about that today. We have some really interesting stuff: infrared light, hands-free pulse ultrasound.
Yeah, I can't wait to hear it all again.
With the ultrasound, uses high voltage stim in the same apparatus. We have the top of the line stuff, and we'll talk about some of the stuff that is out there but we don't like. Like some of the stem cell injections, and some of the invasive stuff I think is a little bit risky. We have stuff that I think is a lot safer and just as effective. So let's go to my iPad. For people who are on the podcast, you might want to go to YouTube. So this is heel pain. This is a diagram of it, and you could see, we have it in the picture here. The Achilles tendon is in the back, the calcaneus, and for people who don't see it, it's hard. And there's nerves that come down here, and there's the band of tissue. It's called the plantar fascia, right? And it's very common, and we see it a lot. So what is heel pain? So heel pain is a very common foot and ankle problem. You might experience pain, soreness, or tenderness anywhere in your heel, but most common area is underneath or in the back. A lot of people, and we call that plantar fasciitis or Achilles tendonitis. The most common symptoms I see is you wake up in the morning, first couple steps kills you. You could hardly walk. Eases up a little bit, but by the end of the day, it's hurting again. Going from a sitting to a standing position is really brutal, especially you get out of your car. I mean, it's bad. And
putting your weight on that heel is, that's a nightmare. Yeah.
So we go here. What are some of the causes? So, and we're going to dive into this, and then we'll talk about treatment. So one of the things that could cause your heel pain is Achilles tendonitis. So, and again, we're going to, it's called calcaneal tendon by some people. And, again, here's a diagram of it. This is the back of your leg. You can see the calf muscle. You can see the Achilles and then the heel. You can have an injury anywhere along that whole Achilles area. It's quite large, and it could be a tear, it could be a tumor, it could be injury, a complete tear or a partial tear, and you get this pain. Now, if you have calf pain, you definitely want to get in to see me, because the other thing that could mimic calf pain is a blood clot, and we have to make sure that you don't have a blood clot.
Yeah.
So if you got a lot of calf pain, don't mess around with it. Okay, and these are just some of the things here. So let me get out of here. So that is Achilles tendonitis. What else is there? Well, you could have. You can stay with me, Jeremy. We're gonna, and the overuse inflames the tendon. Tendinosis or tendonitis again is injury to the tendon. We see a lot of that.
Yeah.
Now, what do you do for that? We have now infrared light therapy. We have pulse ultrasound with at the same time simultaneously doing high voltage stimulation. I think is very important. We have orthotics. We have rest. Rarely do we need to do surgery on these patients. So we usually don't use.
So there's a lot of in-house stuff.
Yes.
During a routine visit that you can take care of right then and there.
Right.
Yeah.
The other thing you see is they have in the literature here is called bursitis. So it's actually a small fluid-filled sac called the bursa, and this is in the back of your heel. And these things can get inflamed. I think people have heard about their hip, bursa.
A touch of bursitis.
Yeah, so that's just a nice little thing. The other thing that we see, and this is called Haglund's deformity. I know and that's spelled Haglund, Haglund's deformity. You usually see this in younger people and in women because it's they call it sometimes a pump bump, and you get a lot of pain in the back of the heel, especially when you wear a lot of pumps, high heel shoes.
I get that.
You get that, and we're going to show you the picture here, and you could see that from the photo here. It's a growth.
Oh, so you see this protruding.
You can feel in the back of your heel, yeah.
Yeah, poking. It's not poking through the skin, but you can feel the bump of it.
Yeah, it's a growth, and here it is here. It's an irritation.
Irritation.
So you can see the redness in the back of the heel. Yeah. And that's called Haglund's deformity, and it can be very painful. Usually, again, you see it in young people. It could be a bony growth, and you could see and feel it through the skin, actually.
So you can. So those of you watching at home, and you're suffering from this kind of pain, you can just feel back behind, and you might be able to feel a lump there, and you already know what needs to be done, and you can call Dr. Kachmar. Right.
Now, the other thing we see, and this is in adolescents, people who their bones are not fully developed, and this is called Sever's disease. That's Sever, Sever's disease. I wrote a paper about this many years ago, and we call that calcaneal apophysitis. And basically, during a growth spurt, child can experience pain in the tendons, bones, and a cartilage. And so Sever's disease is a common condition in children. We see it in the heels. It's called Sever's. In the knees, it's called Osgood-Schlatter's. You can see it in the hip. You can actually see it in the outside of the foot, too. Now, and these are areas of growth of the bone that get inflamed. And so I don't see if we can see a picture here. I don't know if they're going to show us a picture. Probably not. Can adults have Sever syndrome? No, it's only in children.
Okay.
So it has to do with the growth plate, and the most common symptoms is pain in the back of the heel. Pain can cause children to walk on their toes, and again, you got to come and see me because we're gonna do an X-ray. We're gonna make sure there's nothing else going on. I've had a child who had a infection in the heel. They had a summertime flu that turned out to be salmonella, and the bacteria settled in the heel. So, I mean, if you have a child with pain in the heel, it's not, most likely it's not plantar fasciitis. It could be Sever syndrome, but we need to get X-rays. We need to examine the patient. I mean, it could be rheumatological disorders, juvenile arthritis. I've seen that, especially with swelling. Again, that's why I think, you need to get in to see us at least once to get a diagnosis,
So this is for ages between 8 to 14. Dr. Kachmar is well trained with children, even autistic children. If you worry about bringing your child and the doctor understanding and being able to treat a child of autism, no worries. Dr. Kachmar is the master of the lower extremities for a reason.
Right. So another thing that can happen is we call a bruise, not bursitis, but a bruise. So some people fall down, they hit their heel, coming up a ladder, and they call it ecchymosis. So ecchymosis is when you see, if you look, when you sprain your ankle, kind of like that bluish U. That's actually blood inside, pools underneath the skin. So if you see that, definitely you want to get in to see us. That means there's something bleeding inside. And that usually happens a lot of times with a contusion. You know, you fall off a chair, you hit down. And we definitely want to get some x-rays on that. Because especially if you're on a blood thinner, say on Eliquis for like atrial fib or what, a lot of people are on blood thinners. Well, you could have a minor contusion, fall on your heel, fall off a chair, and then it bleeds in there, and it really bleeds bad. And and you could get what's called a dissecting hematoma. So we want to see that. If you see that, put some compression on it, and get to see us. Let me just keep going here, Jeremy, because So then we have stress fractures. Now, a stress fracture is actually a fracture that happens over time in a bone, and that's usually secondary to running. You're not gonna, normally you don't see a stress fracture in somebody who just walks. But if you're training for a triathlon or some kind of event, and you're running every day, and the pain's getting worse and worse, you could actually develop a crack in the bone over a certain amount of time. That's called a stress fracture. Again, we need to examine it, x-ray. Sometimes we don't see it on x-ray, we order an MRI. But you got to be careful about that. If you're having a lot of pain by running, you want to back off a little bit and get it checked out.
So if you have a stress fracture, how are we getting rid of that?
Well, that is treated just like any other fracture to a large extent. No more running, no more jumping. Sometimes we put you in a cast. Depends on your age and how bad the stress fracture is. Usually put you in a walking cast or maybe crutches, and it takes 4 to 6 weeks to heal. You got to be off the bone. You got to let it heal. So obviously no more activity. There's no other way around it. So then we got the
heavy hitter.
The heavy hitter, plantar fasciitis. So people come in, they go, I got this plantar fascia stuff here. They don't know. So plantar fasciitis is basically, the word plantar means the bottom of your foot, plantar. Like your hand is palmar, the bottom of your foot is plantar. So it just denotes a place. And fasciitis, it's a fascia, it's a tissue that gets inflamed. Itis is inflammation, pretty much, okay? See this very often. So we got a picture of it here. Let's go up here a little bit so people who are looking. So here it is. So there's the plantar fascia, again, from those white bands. It goes from your heel all the way to each toe, the plantar fascia.
Really?
And then if you look over here, it says this is a flat foot, but this you can see the plantar fascia is all kind of red and wobbly, but it's all inflamed.
See that little lump there? Is that
that's nothing.
No?
That's nothing. That's just the calcaneus bone.
The reason why I ask is because I've had this, and how it feels and what it looks like on this chart almost feel like they're two different. Like when I stepped down and I had the plantar fasciitis, it felt like a little knife.
Well, that's not, and that's the plantar fascia. The nerve can be impinged, and there's also spurs in there that you get.
Oh, okay.
So let's look at the heel spur, which what you're talking about.
Oh,
probably
we're leading right into it.
So plantar fascia. So you have plantar fascia. And a lot of times the plantar fascia and heel spur are together. They're almost you get a plantar fascia initially, and then you develop into a spur. So so plantar fascia could be just early development of heel spur. So heel spur is bone growth that pokes out below your back of the heel or underneath. And this is the ligament continue pulling on it. Let me see if I have a picture of it here for you. And wouldn't it be crazy if there's no picture here? So just give me a second. Mm-hmm. So a plantar fascia heel spur is significant, Don't tell me they don't have it here. Let's see. I'm trying to find it, guys. I had it and we lost it now. It's missing in action.
Yeah.
And isn't that terrible? Huh?
What's that? Is that?
No, let me find it here. So a heel spur actually is pretty interesting. We remove them sometimes surgically, if we have them, and they hurt quite a bit. Let me see if I get another picture here. So let's see bone spurs here.
Do you grind them down?
Yeah. So here's a picture here. So there's your bone spurs.
Oh, wow.
So you have them on the top and on the bottom. So people who...
All right, see that one on the bottom?
Right.
That makes more sense to me now.
Right. Now, the banded tissue attaches to that. So you don't see the banded tissue here, which is the plantar fascia, but it attaches to that.
Yeah.
So it's a whole... When you have a plantar fasciitis heel spur, there's nerve involved, there's plantar fascia involved, there's bone. It's more complex. It's not just one thing. It's usually all of them, but at different degrees of producing the symptoms. So that's what you got there. And these are nice to see, And there's nerve involvement in there. There's a nerve that goes there. So it's a complicated scenario. That's why really what you need is you need to have somebody really look at this who knows what they're doing. I see people come in my office who've been seen by primary doctors, and thank God the primary doctors are good, but they're good for colds, coughs, maybe diagnosing cancer, but they're terrible in heel spur, plantar fasciitis. And a lot of podiatrists don't specialize in this. They don't know what, go to the drugstore, get this, and they blow you off,
Right.
They really don't, they don't have the full treatment protocol that we have in our office. So, and now there's other things that heel pain, of course, being heavy, arthritis, flat feet, high arches, all of these things, predisposed to it. Running or jumping a lot, spending a lot of time standing, especially on concrete floors, is brutal.
Yeah.
Brutal. And I tell you the other thing too, wearing improper shoes. I get these people come in here, they wear the garbage, especially in the summertime. They get really bad plantar fasciitis. They're wearing flip flops or no shoes at all.
Oh, give me a break with flip.
And that really hurts,
Yeah.
So again, care and treatment. You need an exam. You could have poor circulation. I've seen people come in, their heel pain was really a blood clot, arterial clot in their arteries. And if we still are doubtful and you're not getting better, we'll do MRIs, we'll do more X-rays, blood work. We do a lot of blood work to see whether or not you go back to me, Jeremy. Yeah. We do a lot of blood work to make sure there's no rheumatological disorder. So again, we have a heel pain clinic. We recommend that you come to us. Jeremy, put up our phone number again for the people. So the office number again, if you guys want to call for an appointment, is 732-269-1133. Now, how do we treat it? Well, now we do a couple things. I give injections. We use a special needle. The needle we use is the needle that you use for acupuncture. Very thin needle. Mm. Okay. Most of the time, we spray it. What we'll do is we'll spray it with cold medicine. Yeah. And most people don't even feel the needle.
No, you're not going to feel that.
And then you might feel the medicine going a little bit, but I'm very gentle. Everybody's like, I didn't even feel it. So we're pretty good.
Yeah.
We make orthotics, inserts. This is another thing. Most insurances cover it. Hmm. And between those two things, an orthotic, which is an insert, and injections, right? 95% of people are cured. We may give you some anti-inflammatories. Now, we don't like giving Motrin or Aleve. We prefer to give a medical grade, it's a medical food, and it's very safe. And you can take that for a month or so, and that helps. It's really good. It reduces the inflammation. Right. And then for people who are, who have really bad cases and say the shot and the orthotics are not doing it, or if I think it's necessary, we have other new and improved and very, very amazing technology in the office. Okay, so the first one we're going to show. Hang on, let me just get the thing here. Yeah. So do me a favor, pull up our thing. So this is our light therapy. This is amazing. So we use the company we're dealing with is Hill Labs. They're very good. So this is a Horizon 2 LED, infrared, and red light therapy. It's a lot of power in it. It's 800 MWs of infrared, that's 880 nm, and red 660 light. It's 36 infrared super luminous diodes and 7 visible red super luminous diodes, all delivering through a 2-inch diameter surface plate, a dose of 4 joules centimeter squared, and takes a little over 90 seconds. This is state-of-the-art healing here. We use this. I mean, it's amazing how much this helps. And what the studies show, I'm going to tell you what it does. It says promotes cell-level drug-free healing. Right. So I'm going to read. It says studies show that light-emitting diodes, which is LED, like those designed into the Horizon 2 therapy unit, stimulates the basic energy processes in the mitochondrial, which is energy compartments of each cell. Evidence indicates that cells absorb photons and transfer their energy into it's adenosine triphosphate, which is ATP. the form of energy that cells utilize. The resulting ATP powers metabolic processes and synthesizes DNA, RNA, proteins, enzymes, and other products needed to repair or regenerate cellular components. In short, light therapy facilitates and stimulates the healing process. Put that in your pipe and smoke it.
It also does a whole lot of other things as well. I've been reading, like if you
makes you smarter and more money.
If you want to take care of your wrinkles, I saw a woman use something very similar to this, same stuff, and she was putting it up on her forehead, right? And so her forehead was very wrinkled, and she just gives it a couple of wipes across from up and down, and you could see them go away. Like it would come across like this and then vanish.
Yeah.
You know, I mean, it was really good. So this is like legit next level stuff right here.
Well, yeah, and the thing is, a lot of people don't have this, you know, and we offer this, and it's dedicated for heel pain. That's our clinic. We're not, you know, and I know a lot of doctors are doing all kinds of things, but we're concentrating on heel pain. So, you know, we have a dedicated clinic. Now, we're doing the PT in the office twice a week. In the Barnegat office, we have a dedicated staff there, and the other thing too is, you know, it's very, very easy to do, and it's very what's the word I want to use? Very safe. Now, so here's what I want to do. Now, the other thing is, a lot of times you'll go to, hang on, just keep me on there. So you'll go to physical therapy, right, or wherever you go, and they do ultrasound, but they have to use a hand piece, right, and they got to move it around. You understand what I'm saying?
Yeah.
Well, you know what it is? It's not cost effective for them. They don't want to do it, okay? They don't get paid a lot, and it's hard to sit there for 10, 15 minutes is really what you need of ultrasound, okay? So what happens is you go there, they might give you 5 minutes, and that's it. So we have now a very, very specific ultrasound machine. It's hands-free, okay? And go to the video, as they say. So let's look at it. So we're using this model here. This is called the HF54 Plus. Is the first and only ultrasound cleared by the FDA for hands-free use, which means we set you up, and we could we could give you that amount of time that you need, 10 minutes, 12 minutes, whatever you need. And it's consistent. I don't have to sit there, you know, and do it, or a girl, and it's really important. Now, the red light, I put that myself, but it's 90 seconds. But this here is an amazing, amazing thing. That's the head right here. And what's interesting about this is that, so if you read here, it's so the H54 produces an even distribution of sound waves throughout its large 3 3/8 sound head of 3 uniform and homogenized crystals. The molded gel pad is the connective medium of the transfer. So we use this gel pad, right? So eliminating the need for messy tubes or bottles of gel. It's amazing. We have these pads that we put there. They're kind of solid gel. And at the same time, we could do high voltage stim, which is, you ever have where you get that zingly, you know, they put the things on you.
I've had
a TEDS unit, but this is medical grade. It actually, we put another what do you call it, apparatus on you, a pad, and you get not only ultrasound but high voltage stim at the same time.
Oh wow!
So what we do is you come in, we do the red light first, and that excites the cells on the healing process, and then we give you 10, 15 minutes of this, and it's amazing. So if you look here, I mean, this is on the elbow here. So it's difficult. So here's the thing: reduce error versus traditional hands-held ultrasound. It is difficult for providers to properly administer manual ultrasound for 10 minutes or more. However, studies show that ultrasound over 10 minutes are much more effective. Moving a traditional ultrasound over a large area reduces the ultrasound dosage to the target injury, which therefore reduces the effectiveness of ultrasound. So this is administer a safe, low-intensity pulse ultrasound over a larger area. You understand the significance of this? Nobody has, a lot of people don't have. This is on the back here, and you could, so here, combination interferential muscle stim and pre-mode current. So comes standard with 2 channels, stimulates curve. Can be used in combination with ultrasound and through 1 or 2 sound heads. So it's amazing. You're getting that there's really, I was talking to some of my physical therapy colleagues. They don't have this. They don't have this in any of the places. None whatsoever. So it's really good. So you could go back to me, Jeremy, please.
Okay, buddy.
So, just go back. I just want to show the unit here. Let me just see. Hang on a second. Let me just see. Okay, that's good. You could shut me down.
Okay.
Thank you. So, what are we on time, Jeremy? Because we don't want to. I know we have.
We're just about 30.
Okay, good.
Coming up.
So,
We got 5 minutes.
So here's the deal. We're gonna call it a day today. We wanted to do a short show today. Talk about our heel pain clinic.
Yeah.
Our physical therapy center is located in Barnegat, New Jersey, right off the Parkway. It's very convenient for a lot of people. You could give us a call. You can make an appointment. If you are being treated by somebody else for heel pain and you're not getting better, why don't you come for an evaluation? We could give you some physical therapy. We could try our modalities, which I think is amazing. Now, the other thing is, so people ask me, what about insurance? If your insurance doesn't cover it, we charge $35 for a visit, which is basically your copay for insurances. If you have an insurance coverage for PT, it's usually what is it? It's $35. So what are you going to ask, Jeremy?
Well,
you have a
this question? This is the patient question.
Yeah, go ahead. Ask me. The man on the street.
Right, I'm the man on the street. So how long is the duration of what kind of relief am I to expect? You know what I'm talking about?
So that's very good. A lot of people get it immediately. They feel great.
Okay.
All right. Some people it takes a little longer. What we recommend is twice a week. All right, for maybe 2 weeks, maybe 3, if that's necessary. What I found is that in combination with an injection and maybe some of those anti-inflammatories, it comes around really quick.
Yeah.
So everybody's different. It depends on how bad the pain is. If you have a big spur or not. But most likely, like I said, you'll see improvement right off the bat.
Yeah, so this is really activating the area where the discomfort and pain is coming from,
Right,
and making sure that it's going to
help. Well, I tell you another
Heal
thing.
it up.
I tell you another thing. Even though my
promotes healing.
right, even though my injections are, in my opinion, very very minimal discomfort, some people don't like needles. So instead of giving them another shot, cause sometimes after the first shot in 2-3 weeks, the pain comes back a little bit. So instead of getting another shot, a lot of people opt to have the therapy.
Right.
And that does very well too. Instead of getting another shot, they get the therapy, and that kind of cleans up the the residual pain.
Yeah, yeah.
Now, I mean, you could also get a shot. It depends on again.
It's good to have that choice, because
right,
some patients do not like shots.
No, and
they don't like any of that
right.
stuff.
So we tell them, listen, you want to come in, it takes 5 minutes to do a shot, maybe not even, or if you want to try some more therapy, maybe come in twice a week. You got to be there for 15, 20 minutes, but it's your decision, and we give you that option. I'm cool with that.
Yeah.
I think that is very important to think about. And like I said, the therapy that we use is state of the art. This stuff is really, really, really good, and so I think that's the way to look at it. We also do orthotics, which we'll talk about that another day. But orthotics are very important, and the thing with orthotics is that a lot of people who have a structural deformity causing their plantar fasciitis heel spur makes a big difference. And if you have a heel spur, you need orthotics, for.
And what you provide is molded to their foot. So
yes,
it's not like these cheap things you find at the pharmacy that are just flat cushion that you slip into your shoes. This is like something that's molded to the shape of your foot, and it's designed to help you.
Yeah. And we use a very good lab. Most insurances, like I say, cover it. The lab we use is like one of the best. I've been using them for about 3, 4, 5 years. 5 years now. I tell you what, the product is amazing, and it's just amazing. So anyway, Jeremy, we're going to say goodbye. We'll be here next week, same time. So
Maybe we can do a longer show, right?
yeah. We're pressed for time today. But anyone, thank you for checking in with us. My name is Dr. Michael Kachmar. I'm a board-certified reconstructive foot and ankle surgeon. Give us a call at 732-269-1133. Again, we're on all platforms. Please go to YouTube and like and subscribe. We're on Instagram. Also subscribe there. You'll get notifications, and Rumble and everywhere else. And we're on Spotify. So have a nice day. Goodbye. Jeremy, send us home.
Yeah. For more information about Dr. Kachmar and all these wonderful things we talk about, please go to JerseyShore FootAndLegCenter.com. Take care, everybody.
Bye-bye.
Be kind to each other.
Bye.